about to watch a video titled, Breaking the Healthy Breakfast Trend Hurting Seniors. One simple swap cuts LDL cholesterol 20% age 60 plus. The main health problem here is high LDL cholesterol in adults over 60, which raises the risk of heart attack and stroke. The promised solution is one simple breakfast swap that can lower LDL by around 20% in the right context, especially when it replaces a breakfast pattern that pushes LDL upward. This is critical after 60 because LDL damage is silent and cumulative, and one major cardiovascular event can take away mobility, independence, and years of quality life. If you over 60 and you eat what you believe is a healthy breakfast every morning, there's a chance that routine is quietly raising your LDL cholesterol and you won't feel a single symptom until the day something breaks. Heart disease remains the leading cause of death in the United States, and stroke is a leading cause of long-term disability. What makes LDL so dangerous is that it doesn't hurt. It can feel perfectly fine while plaque builds inside arteries for years. And right now, a popular healthy breakfast trend often high in saturated fat or heavily processed can worsen LDL in many seniors who are trying to do the right thing. To ground this in clinical reality, imagine Dr. Marcus Ellington, preventive cardiology physician with 18 years of experience and more than 6,000 patients treated, most of them aged 60 and older. He sees the same pattern repeatedly. When patients reduce saturated fat and increase soluble fiber, especially at breakfast, LDL can drop measurably within 4 to 8 weeks. In a large portion of consistent patients, the reduction is solidly in the double digits, sometimes enough to meaningfully change their cardiovascular risk profile. Here's the science in plain language. LDL particles carry cholesterol through the bloodstream. When LDL stays high, those particles can enter the artery wall and trigger inflammation. Over time, this creates plaque atherosclerosis. After 60, this becomes more urgent because arteries have had decades of exposure, and the consequences of a heart attack or stroke are often more devastating. Breakfast matters because many common breakfast choices push LDL in one of two directions, either toward more LDL by increasing saturated fat intake, or toward less LDL by increasing soluble fiber intake and improving fat quality. Now let's debunk the biggest traps. The first is the keto style or clean. High-fat breakfast that quietly overloads saturated fat things like butter-heavy coffee drinks, coconut oil, heavy cream, bacon, sausage, and some high-fat cheeses. In many people, saturated fat raises LDL. The second trap is the sweetened, healthy breakfast that's actually ultra-processed flavored yogurt. It's sweet granola, breakfast bars, and cereals with a health halo. These foods can be high in added sugars and low in real fiber. The third trap is thinking, I'm not overweight, so cholesterol isn't my issue. LDL is not just about body weight. Genetics, age, and diet quality can elevate LDL even in thin, active adults. Now for the solution. The simple swap is to replace an LDL-raising breakfast with a soluble fiber-forward breakfast. It's anchored by oats or psyllium, and to shift fat quality toward unsaturated fats. Soluble fiber helps lower LDL by reducing bile acid reabsorption, and replacing saturated fats with unsaturated fats helps lower LDL in many people. For breakfast, use oatmeal as your base. Add berries, add ground flax or chia, and add walnuts. Use low-fat or unsweetened dairy or unsweetened soy milk instead of heavy cream. Keep added sugars close to zero and use cinnamon and fruit for sweetness. If you want an additional lever, use psyllium husk daily with adequate water, starting small and increasing as tolerated. Take it away from medications. Finally, swap butter, coconut oil, and heavy cream for olive oil, nuts, seeds, and avocado. Reduce daily processed meats like bacon and sausage, and replace sweetened yogurt with plain yogurt plus fruit and oats. If this is helping you, like the video, subscribe, and comment your age and your biggest concern: high LDL, blood pressure, prediabetes, belly fat, or low energy. This channel is dedicated to senior health and longevity. High LDL cholesterol is silent, but it is not harmless. A simple breakfast swap towards soluble fiber and healthier fats can protect your arteries, preserve your mobility, and reduce the chance of costly hospital visits and long rehab stays. Subscribe and watch the next video for more senior-friendly, evidence-based strategies. This video is educational and not personal medical advice. If you have chronic conditions or take cholesterol medication, talk with your clinician before making major diet changes.